of, what is today? April 5th, 2021 to order. Sandy, could we have a roll call, please?
Councilmember Shippers,
I am here in Cadillac.
Ellenboss, Ingalls, King,
Present and in Cadillac.
Mayor Filkins.
Here and in Cadillac. Okay, at this time, if someone would consider a motion to approve the agenda as presented this evening.
Councilmember Shippers, I will make a motion to approve the agenda as presented.
This is King. I'll support.
Councilmember Ellenboss, Ingalls, King,
Yes.
Shippers,
Yes.
Mayor Filkins.
Yes, motion carries. At this time, we'll open the floor for our first public comment. We do ask if you'd like to comment that you state your name and where you're speaking from, and keep your comments to 3 minutes or less. And Laura, if you could help me if you see any hands raised.
I do not see any hands raised at this time.
Okay, if we still don't have any, we'll close the first public comment. And this evening, we're going to move on to a community spotlight. And so I'll turn that over to Mark.
I'm sorry, Mayor Filkins. Someone is just entering from the waiting room just as you started to speak.
Okay.
Mr. Filkins just entered.
Okay. So at this time, we'll go ahead and move on to the next thing on our agenda, and that's the community spotlight. And I'll turn it over to Marcus for him to introduce them.
Thank you, Mayor and members of the City Council. This evening, we have a community spotlight. We have representation from Mobile Medical Response here, Paul Owens and Jason McDonald accordingly, to give a brief update to Council and the community accordingly with respect to their new services here for our city and area. Gentlemen, the floor is yours.
Well, thank you for inviting us tonight, first off. And at this time, I think I'll turn it over. We have Jason McDonald here. He is the Vice President of Operations and the COO for Mobile Medical Response. And I'll let him talk.
Well, thanks, Paul. I guess, we'd much rather be there in person so we can meet everybody, but, we certainly understand the restrictions that we're all living with. But we wanted to take a quick moment to introduce ourselves. As you know, Munson Healthcare recently became a minority owner of Mobile Medical Response, and we assumed operations for the area that Northflight EMS had traditionally covered. That was in the community's eyes and in the public's eyes, that was a very fast transition. And that happened that way for several reasons. But it was a decision that took many years to work out, actually, with Munson Healthcare and Mobile Medical Response and our boards of governance. And during that process, confidentiality was, of course, critical to make sure that governance boards had the ability to work and be efficient. So I wanted to tell you a little bit about our organization. We started in 1994 as a nonprofit organization, and that's a misconception that many people have about Mobile Medical Response. We are a nonprofit healthcare and public safety organization. We cover 17 counties across the state of Michigan, and we were formed by Covenant Healthcare and St. Mary's at the time. You had two competing ambulance services in one county, each owned by a hospital. They were beating each other up for limited revenue, and neither one of them was sustainable long-term. The hospitals got together and formed a separate nonprofit organization and combined resources. EMS, one of the things we struggle with is that we can't necessarily post billboards or advertise and secure more business. And one of the other things that constrains us is that we can raise our prices, but 80% of the people who pay us what they pay, and sometimes it's 10 to 15% of the charge, and we have to simply accept that from the federal government and state government. So that's a whole other topic we could get into. But the hospital saw the wisdom in that, and they formed that nonprofit organization so that it could operate efficiently. That model became very successful very quickly, and we grew over the years now to a total of 17 counties that we serve across the state of Michigan. We have a fleet of about 120 ambulances including the North Flight group, will transport about 120,000 patients this year and handle about 160,000 incidents in our medical communications center. And one of the things we're very proud of is the fact that we hold multiple accreditations. Jason McDonald and Paul Owens can sit here on your computer screen and tell you a lot of wonderful things about mobile medical response. And to some extent, that's our job, right? One of the things that we really pride ourselves on is the third-party accreditations that we hold. We are CAS accredited by the Commission on the Accreditation of Ambulance Services. We have been since 1997. Our recent reaccreditation found no deficiencies. And that speaks to the entire organization. And they essentially come in and make sure that we're doing the things that we say we're doing. And they hold us to a certain set of standards that are produced at a national level. Our dispatch center, our medical communication center, is an accredited center of excellence. We were the first in the state of Michigan to receive that accreditation. We're one of just a few in the state that actually hold that and maintain that accreditation. And it speaks to the quality of the pre-arrival instruction and the dispatch service that our service offers. We're also accredited through the Commission and the Accreditation for the EMS professions. That's our education arm, essentially. That's another third-party accreditation that assures the programs we're teaching are compliant with national standards. We're also QVM certified, which is a Ford certification that speaks to our remount process, where we remount ambulances within the organization. And then our billers are all certified as well. They're certified ambulance coders. That assures that we're maximizing the benefit of any third-party payer. If someone is transported by MMR, we want to make sure that we're billing it appropriately and that we're trying to find every payment source outside of sending the patient any remainder of a bill or a balance. And that's critical to us. What happened with Munson is that Munson made the decision that they were going to turn the North Flight assets over to mobile medical response. In exchange for that, Munson Healthcare received an equity stake in mobile medical response, equivalent to the value of the assets. For that, Munson Healthcare has a seat on our 7-member board of directors. They also have a seat on our finance committee, our finance board of governance. So Munson Healthcare, or Munson Health System, has retained a significant amount of control and a significant amount of not just financial investment, but a significant amount of input into how mobile medical response operates and how we function in the areas we're now serving that were traditionally serviced by North Flight. One of the things that we felt was very important coming into this arrangement was that Paul Owens stay on with mobile medical response, and he graciously has agreed to do that. Paul's a proven leader in EMS in your community and in surrounding communities in Manistee and Traverse City. And Paul's been a great person to work with. Any of you that worked with him can attest to that. And we really appreciate all the hard work that he's done. One of the things we also wanted to be sure of is that as we came in, we wanted to make sure that we were servicing the community and the health systems appropriately. We have had some transition issues, and I think some of you probably have heard a rumor of that. You know, not all the employees from North Flight elected to come over to mobile medical response, and each of them had their own reasons for doing so. We also lost some of the pool employees, we called them, who were people who maybe were a paramedic and a nurse, and they worked at the hospital and they'd work their normal shift. Well, then they'd come and work the ambulance for overtime at their hospital or RN rate. Obviously, with the additional separation between the EMS agency and the hospital, they could still come work for us, but it would be a time, and that's simply not as appealing. So we lost quite a few of those employees as well. Since then, we've hired 12 or 13 people into the Northwest system since the acquisition, and our goal is to deploy at the same or better levels than what North Flight EMS was deployed at prior to the merger. I can tell you in Wexford that that's our goal, plus that Manton car that sits north of the city in the northern part of Wexford County was traditionally covered with an on-call system. We're working to staff that 24/7 with a crew that is actually housed there and able to respond. We found over the years that on-call or volunteer type services for EMS transportation agencies simply have become outdated. There aren't enough people willing to operate that way. And we find that it's pretty inefficient and unreliable. And in fact, our accreditation recognizes that and won't allow us to operate with an on-call system as a primary response vehicle. So we're looking at staffing that, which is additional expense and additional personnel, but we believe it will actually provide better coverage for the county and for the residents. We will continue to work with the city and county. We've been meeting with your city manager, mayor, and some other stakeholders. We're also meeting with the health systems regularly. We've been meeting with county government regularly as well. There's a committee there that we meet with, as well as the 911 center, to make sure that we're doing everything we can to work together, to work efficiently, and make sure we're providing the level of service that residents and citizens expect and deserve. With that, I'll turn it back over to Paul. I'm sure, Paul, that I missed something in the notes that we covered, but Paul, what would you have to add to that?
I think you covered it great. So other than we're just working on staffing, and like Jason alluded to, we've hired, I think, 12 new hires. It's a very difficult market right now in the trade industry, finding, employees or potential employees, and EMS is no different. So there's a big time shortage, state and national, for EMS workers and paramedics and probably police officers, right, Adam? So it seems to be, just a lot of different trades are hurting right now, and EMS is no different. So, but I'm happy to report we continue to get applications. We received another one Friday on a local EMT that lives and works in Cadillac that we will be interviewing. So it's just going to take a while for us to get back up to staffing, especially starting with that Manton station, 6 or 7 positions right there to fill, which was a huge cost for MMR to do that. So several $100,000s of dollars to staff that 24/7 that we were just unable to do when we were in Northlight EMS. So with that, if anybody has any questions, we'd be surely open to taking any questions you might have.
Do you have a better projection of when the Manton car is going to be available?
Well, we're making some progress there. We actually have one shift kind of filled with a full-time paramedic and a full-time EMT. We hired a gal out of Manton. Actually, she lives just inside of Missaukee County. She's an EMT that we hired last week full-time to staff that Manton station. So, and then the other gal I just mentioned that lives in Cadillac, if we could put her in Manton, that would, we would have 2/3 of that department filled up then. So obviously we'd like it to be staffed ALS, but if we can get it staffed BLS, then that's what we'll do.
Thanks for the update.
Yeah, it's a good question. IPR just had a really good article about the staffing shortage for EMS in the state of Michigan, and it was localized to Northwest Michigan. And one of the things in there is that the Michigan Association of Ambulance Services, and we're on the board of directors for that association, they're asking for a $10 million increase in Medicaid funding annually to help support EMS reimbursement. When we transport a Medicaid recipient, a state healthcare product, essentially, when we transport those patients, we receive about 10 to 15% of our charge. And with Medicaid, you can't balance bill. You accept the 10 to 15% and you'll write the rest right off. That's an enormous burden on EMS in the state of Michigan. And we know as an EMS industry that we need to continue to raise wages and make the field more appealing. That's a big push right now with our industry, with our association. So I would appreciate it as elected officials, if you get the opportunity to speak to someone at the state level, or they ask about that, we certainly would appreciate your support as an association, as an agency, and as an industry. $10 million in the world of dollars that are being thrown around today isn't really a lot of money, but it would be an enormous impact across the state of Michigan for EMS and people who are working on the front lines. So I'd encourage you to check that out.
That takes me to another question. Do you currently, because MMR covers so much of the state, do you currently have active legislatures down in Lansing working on behalf of MMR?
MMR does not employ a lobbyist directly. We work through the Michigan Association of Ambulance Services, and the dues to the association are based on the number of vehicles that you have. So we're a substantial supporter of the Michigan Association of Ambulance Services. They do employ Brett Maher as a lobbyist in Lansing. very well-known figure down there, and he lobbies on our behalf and has done an amazing job for us. And so has Angela Madden, the executive director. She's been fantastic. And they're doing a great job. So we believe it is part of our mission. It's part of it's one of our strategies to make sure that we're engaging in Lansing, but also because we cover such a large area, we have access and stake with a lot of different representatives and senators. We try to make sure we're engaging with each one of them, and having local people make sure they stay engaged as well. And we are starting to believe that may pay off here soon, with some gains from the state legislature and from Medicaid as well.
Great. Does anyone else have any questions? Comments? Thank you, Paul and Jason, for coming to speak to the council tonight. I think it was important for them to meet you, not in person, but next best thing.
Sure. If you ever have any questions, Marcus and Adam both have our contact information. I believe you may as well, Mayor, and just please reach out anytime. We're more than happy to chat.
Okay. Thank you.
Thank you.
Thank you.
Okay. The next thing that we have on our agenda this evening is that we have a FOIA appeal. So I am going to send this over to Marcus for an introduction.
Yes, thank you, Mayor and members of the City Council. We have an appeal this evening from Mr. Beaudry, the same gentleman that appealed the last couple of times the council has had facilitated and host a FOIA appeal. Similar to the last times this happened, the process would be the same. And with no further ado, I'd like to introduce our city attorney this evening, Laura Janovich, basically to open it up and provide some background information as to the appeal, along with consideration for council to take.
Great. Thank you, Marcus, and good evening, members of City Council and the public. And I believe the appellant, Mr. Beaudry, is on the line as well. And sir, you'll also have an opportunity to address council. So I don't want to put words in your mouth, sir, but I want to give the council an overview of what the issue is in this FOIA appeal. This FOIA appeal relates to the fee that was charged, not to what documents should be disclosed or not disclosed or things like that. And the issue that Mr. Beaudry raises in his appeal is the maximum amount that the city can charge under the FOIA for contracted labor. And there's a part of the FOIA statute, don't mind if I'm looking over here, I have two screens, that provides that total labor costs calculated under this section of FOIA for contracted labor costs must not exceed an amount equal to 6 times the state minimum hourly wage determined under, the law for the minimum wage law. Labor costs under this subdivision shall be estimated and charged in increments of 15 minutes or more, with all partial time increments rounded down. So that means that, if Foster Swift reviews something to redact, we won't, the FOIA requester won't be charged our hourly rate. It'll be maxed at 6 times the minimum wage. Mr. Beaudry makes the argument that 6 times 1 hour of minimum wage is the total maximum amount that can be charged for that contracted labor, such that even if it took the contracted laborer 10 hours, that the city could only charge for 1 hour calculated as 6 times the hourly rate. Respectfully, it's our opinion and the opinion of the Michigan Municipal League that is not correct. It's 6 times the minimum hourly wage times the number of hours that are necessary, that are actually used to perform the redaction or other contracted services. And that's supported by the language of the statute, where it refers to those fees being estimated and charged in increments of 15 minutes or more. There's no maximum of 60 minutes. It's increments of 15 minutes or more. With that said, there are 2 things in this fee appeal that we think do have merit. One of those is that there was a 0.1 time entry, which is less than 15 minutes. That should have been rounded down. So we would take off that 0.1. And the second is that it appears that the minimum wage that was used to calculate the fee, it was calculated based on $9.65 per hour, and it should be $9.45 per hour. So applying those in this particular case, it would result in a reduction of the fee by a total of, I think it's $3.17. So that's our perspective on it from the city attorney's position. And then Marcus, I'll turn it back to you, I think, to turn it over to Mr. Beaudry.
Yes, thank you, Laura. At this time, it's been customary for city council to offer an opportunity for the appellant to provide any information that they may want to do before council then takes the conversation back to discuss themselves.
So, Mr. Beaudry, this is Mayor Filkins. I'd like to give you the floor to comment in regards to your appeal, and we will give you 6 minutes on the floor.
All right. I would just like to reiterate the point that I also, or the extra points that I made in the appeal. And it was the very first sentence of that appeal, charging everyone $15 per hour for a clerical and a $31.52 per hour administrative wouldn't be following the law as it states in VA 1B and 3B in the policy that is on the Cadillac, Michigan website.
All right. Do you have any other thoughts?
I would say that that should also be adjusted to the correct levels.
Okay. With your 6 minutes, do you have any other things that you would like to have considered this evening?
I would like an extra fee reduction for that, and as well as the time that this has taken. I don't believe that this is how this law should be working. I believe that the county administration could have, or the city administration could have notified me previously or earlier that identification would have been needed. And that's all.
Okay, thank you. Laura, is there anything else that you might add based on his comments?
Sure, and thank you, Mr. Beaudry. Based on our review, we don't believe any further downward adjustments are warranted or necessary here under the statute, other than the ones I identified before. The city's FOIA policy was followed, and there's no provision for reimbursing a FOIA requester for their time spent preparing a FOIA appeal.
Okay, at this time, I would open the floor for any discussion amongst the council members or any questions that you may have. And if there are none, also would entertain a motion. Steve, you're muted.
Gets me every time. This is Councilmember King. If there's no other discussion, I would go ahead and make the motion to grant the appeal in part and deny the appeal in part as provided by our city attorney at the calculation that was placed on the record tonight.
T.I., you're muted.
Sorry. Councilmember Shippers, I'll support that motion.
Councilmember Ingalls, King,
Yes.
Shippers,
Yes.
Ellenboss, Mayor Filkins.
Yes, motion carries. Okay. Sandy, when you're ready, we have some communications this evening.
It's being recommended to approve the closure of Linden Street between Chestnut and Division Street from 8 a.m. to 8:45 a.m. on May 31st, 2021 for the Rotary Club of Cadillac Stride for Stride 5K.
This is Councilmember Shippers. I will make a motion to approve the closure of Linden Street between Chestnut and Division from 8 a.m. to 8:45 a.m. on May 31st, 2021 for the Rotary Club of Cadillac Stride for Stride 5K.
This is Councilmember King. I would support.
Councilmember King,
Yes.
Shippers,
Yes?
Ellenboss, Ingalls, Mayor Folkins.
Yes, motion carries.
Being recommended to approve the display of a banner from April 6th to April 12th, 2021 for National Library Week.
This is
Go ahead.
This is Councilmember King. I'll make the motion to approve the display of a banner from April 6, 2021 to April 12, 2021 for National Library Week.
Councilmember Shippers supports.
Councilmember Shippers,
Yes.
Ellenboss, Ingalls, King,
Yes.
Mayor Folkins.
Yes, motion carries.
It's also being recommended to approve the display of a banner from April 19th to May 3rd, 2021 for the Cadillac Area Public Schools.
I'll make that motion to approve the banner from April 19th to May 3rd, 2021 for the Cadillac Area Public Schools.
This is Councilmember King. I'll support that motion.
Councilmember Ellenboss, Ingalls, King,
Yes.
Shippers,
Yes?
Mayor Folkins.
Yes, motion carries. Okay, and then this evening we do have a couple of reappointments and a new appointment, I believe.
This is being recommended to approve the reappointment of Jim Blackburn to the Civil Service Commission for a 6-year term to expire on April 16th, 2027.
As Councilmember Shippers, I would like to make that motion to approve the reappointment of Jim Blackburn to the Civil Service Commission for a 6-year term to expire on April 16th, 2027, and to note that he has been on this commission since 1996 and thank him for his service.
This is Councilmember King. I'll support that motion.
Councilmember Ingalls, King,
Yes.
Shippers,
Yes.
Ellenboss, Mayor Folkins.
Yes, motion carries.
It's also being recommended to approve the appointment of Tracy Mickelson to the Board of Review as an alternate representative, First Ward, for a 2-year term to expire on April 5th, 2023.
This is Councilmember King. I'll go ahead and make the motion to approve the appointment of Tracy Mickelson to review as an alternate representative, First Ward, for a 2-year term to expire on April 5, 2023.
Shippers supports.
Councilmember King,
Yes.
Shippers,
Yes.
Ellenboss, Ingalls, Mayor Folkins.
Yes, motion carries.
Being recommended to approve the appointment of Benjamin Dean to the Zoning Board of Appeals as an alternate member for a 3-year term to expire on April 5th, 2024.
I'll make that motion to approve the appointment of Benjamin Dean to the Zoning Board of Appeals as an alternate member for a 3-year term to expire April 5th, 2024.
Councilmember King, I'll support that motion.
Councilmember Shippers,
Yes.
Ellenboss, Ingalls, King,
Yes.
Mayor Folkins.
Yes, motion carries. And I would also add that I stated that we had 2 reappointments and a new appointment this evening, but we actually had 2 appointments, 2 new appointments. And that's pretty exciting to see new volunteers coming out to serve on our boards. So thank you. And that'll take us to the city manager's report for this evening.
Thank you, Mayor and members of the City Council. Report this evening is rather brief. The first item is a request to schedule a public hearing for April 19th, 2021 to discuss the fiscal year 22 annual operating budget.
This is Councilmember King. I'll make the motion to schedule a public hearing for April 19th, 2021 to discuss the 2021-2022 annual operating budget.
And Councilmember Shippers will support.
Councilmember Ellenboss, Ingalls, King,
Yes.
Shippers,
Yes.
Mayor Folkins.
Yes, motion carries.
Thank you, Mayor and members of the City Council. The next item is another request for a public hearing. This one is, again, for your April 19th, 2021 meeting to consider approval of our fiscal year 22 through 2027 capital improvement program.
Councilmember Shippers will make a motion to schedule a public hearing for April 19th, 2021 to consider approval of the fiscal year 2021 through 2027 capital improvement program.
This is Councilmember King. I'll support.
Councilmember Ingalls, King,
Yes.
Shippers,
Yes.
Ellenboss, Mayor Folkins.
Yes, motion carries.
Thank you, Mayor and members of the City Council. The next item under our COVID-19 update includes a couple of quick things. The first one is reminder to everybody to please check out the dhd10.org website for all the latest information regarding the pandemic. You'll find information as to how to sign up and get yourself vaccinated if interested in doing so on that site, as well as seeing the latest statistics in Michigan and access to statistics in the nation. Also, from a carryover from our budget work session earlier this afternoon, another sort of retread on the pandemic financial response plan that we had earlier. Owen, our finance director, is going to share his screen if he's able to show once again the couple of pages that list projects that we would like council to consider this evening unfreezing. And take it from there, Mr. Roberts.
Yep, as we just making sure I'm not muted. There we go. As we talked about in the prior session, as a brief background, there's been a lot of news that's been not nearly as bad as what was feared during the initial stages of the pandemic. And so we're very comfortable bringing these to you tonight. We adopted the plan. The funds are still appropriated, but these particular purchases and this spending was frozen until council would take further action. So at the last council meeting, there was a member that wanted us to bring back up the Rotary Pavilion sign due to the condition of the sign and the opportunity to provide better messaging for the community. And so as part of that discussion, we took a look at other items that were frozen as well. And so the recommendation tonight is the highlighted items to unfreeze that spending. And again, portions of this, most likely, depending on the timing and because of the pandemic, will not be fully spent, but we are recommending the unfreezing tonight. So it's the $27,000 in the city complex, the $25,000 capital outlay for the parks, with the utilization switch to buying and replacing the sign, and then the unfreezing of the 25% of the travel and education budgets. Again, due to travel restrictions, this won't be fully spent, but it makes sense to at least take that action just in case. There are some departments that may have smaller budgets that may spend a little bit more as a percentage. In addition, the 4 purchases that you can see on your screen here for the water and sewer department, because of the progress that we've seen in the improvements since the beginning of the fiscal year, in the fees that are coming in, these are this whole list is needed, otherwise it would not have ever been on the list. However, these 4 purchases we would like to move forward with yet this fiscal year. The truck, the software, this is for helping us with our laboratory management, a storage barn to replace one that's falling apart at the wastewater property, and then the inspection of our newer wells on Crosby Road. So that is the recommendation.
Okay,
This is
thank you.
This is Councilmember Shippers. I will make a motion to unfreeze spending pursuant to Pandemic Financial Response Plan as recommended.
Steve, you're muted.
Sorry. This is
Somebody
Council.
gets you a shirt.
I'll support that motion.
Councilmember King,
Yes.
Shippers,
Yes.
Ellenboss, Ingalls, Mayor Folkins.
Yes, motion carries.
Thank you, Mayor and members of the City Council. The final item under the manager's report this evening is a request for consideration regarding the Rotary Pavilion sign upgrade. The council communication in the public packet this evening includes the prior communication that was provided to council back last May. That also includes information about the vendor and the recommendation. As previously spoken about this evening, a council member at the last meeting requested this come back forward for consideration. We did reach out to Pro Image Design Inc., and they are willing to honor their bid at $19,992.20. Funds are available in our general fund accordingly for this purchase. And if there are any questions, please feel free to ask them.
This is Councilmember Shippers. Am I unmuted? I would like to make a motion to award the Rotary Pavilion sign upgrade project to Pro Image Design Inc. in the amount of $19,992.20.
This is Councilmember King. I'll support the motion.
Councilmember Shippers,
Yes.
Ellenboss, Ingalls, King,
Yes.
Mayor Folkins.
Yes, motion carries. Okay, this evening we do have in our packets the minutes and reports from the last Zoning Board of Appeals meeting along with the Planning Commission minutes. At this time, we'll go ahead and open the floor for our final public comment. Owen, could you unshare your screen, please?
I apologize for that. Moving on and forgot to stop.
I do not see any hand raised, Mayor Filkins.
Okay, we'll go ahead and close public comment and move to the good of the order if anyone has anything this evening.
This is Councilmember Shippers. I would just like to thank the big group of kids who, like ants on Diggins Hill, I think it was at the evening of our last meeting, just went up and thoroughly cleaned up all debris and all trash on Diggins Hill. I watched them. I was heading out and stopped for a minute and watched them just gleefully run around the hill and pick things up. I'm not sure which group did that, but there were adults supervising and lots of kids, and it was just lovely to see. So whoever that is, thank you so much. Good citizenship.
Okay, does anyone else have anything? Okay, if not, we'll go ahead and adjourn the meeting. Thank you all.
Thank you all.
Good.
Thank you.
Good night.